Top 10 medical advancement in history. In the annals of medical history, certain advancements stand out as transformative milestones, reshaping the practice of healthcare and improving countless lives. From the discovery of antibiotics, which revolutionized the treatment of infections, to the development of vaccines that have eradicated devastating diseases such as smallpox, these breakthroughs have propelled medicine forward. Other key innovations include the advent of anesthesia, which made complex surgeries feasible, and the mapping of the human genome, opening doors to personalized medicine. These top 10 medical advancements represent a testament to human ingenuity, perseverance, and the relentless pursuit of better health outcomes for all. Number 10. Antibiotics. Revolutionizing the treatment of infections. The discovery of antibiotics in 1928 by Alexander Fleming marked a watershed moment in medical history. Upon returning from vacation, Fleming stumbled upon a mold in his lab that not only thrived but also inhibited bacterial growth. Over a decade later, in 1940, penicillin, the active substance in the mold, was isolated, revealing the true significance of Fleming's finding. Its effectiveness was swiftly demonstrated during World War II, where it saved countless lives by treating infected wounds. Penicillin's enduring importance as a primary treatment for bacterial infections paved the way for the development of numerous other antibiotics. Moreover, the existence of antibiotics revolutionized medical procedures, enabling once risky interventions like open-heart surgery, organ transplants, and chemotherapy to become feasible. The period between 1940 and 1960 is often hailed as the golden era for antibiotics, with many crucial drugs developed during this time still in use today, underscoring their lasting impact on healthcare. Number 9. Vaccines preventing deadly diseases. The origins of the word vaccine, from the Latin for cow, find resonance in Edward Jenner's pivotal discovery in 1776. Noticing that milkmaids exposed to cowpox developed immunity to smallpox, Jenner pioneered the smallpox vaccine, eventually leading to its eradication in 1977, a landmark achievement in medical history. However, it wasn't until 1950, amidst a polio outbreak prompting parental isolation measures, that the modern vaccine era dawned. Jonas Salk's selfless act of not patenting the polio vaccine in 1952 paved the way for widespread immunization efforts, drastically reducing polio cases globally. This altruism echoes in the development of vaccines for various diseases like tetanus, measles, and HPV, profoundly impacting public health by preventing countless deaths and curbing the spread of deadly illnesses, including the ongoing battle against COVID-19 and its variants. Number 8. Anesthesia. Transforming surgical procedures. Before the mid-1800s, surgical procedures were daunting experiences for patients, often accompanied by excruciating pain and high mortality rates due to the absence of effective anesthesia. However, in 1846, the landscape of surgery changed dramatically with the pioneering work of William T.G. Morton, who introduced ether as an anesthetic agent. This breakthrough enabled patients to undergo surgery without enduring the agony previously associated with such procedures. Since Morton's landmark achievement, the field of anesthesia has undergone remarkable evolution. The drugs and techniques used to anesthetize patients have been continuously refined, bolstered by advancements in medical technology. These innovations, when integrated with modern surgical practices, have led to substantial improvements in patient safety and comfort. The establishment of global standards for monitoring parameters such as hemodynamics, vital signs, and respiration has been pivotal in ensuring the well-being of patients undergoing anesthesia. Additionally, the integration of sophisticated technology enables precise assessment of anesthesia depth, allowing anesthesiologists to tailor doses more accurately to individual patients' needs. Moreover, advanced algorithms assist in evaluating patient comfort levels throughout the surgical process, contributing to a more personalized and optimized anesthesia experience. The synergy between improved anesthesia techniques and cutting-edge technology has not only revolutionized surgical care, but also expanded the scope of what medical professionals can achieve in the operating room, ultimately enhancing patient outcomes and quality of life. Number 7. X-rays and medical imaging. Advancements in non-invasive diagnostics. Before the advent of medical imaging, diagnosis relied primarily on physical examination and patient-reported symptoms. However, the discovery of X-rays by Wilhelm Roentgen in 1896 revolutionized medicine. Glasgow Hospital opened its first radiology department just a year later. Subsequent innovations, such as ultrasound in 1956, CT scans in 1967, and MRI in 1973, further transformed diagnostic capabilities. These technologies utilize high-frequency sound waves or electromagnetic fields to produce detailed images of internal organs and structures. Such advancements have enabled medical professionals to diagnose conditions like cysts, tumors, and abnormalities with greater accuracy and non-invasively, leading to early intervention and improved patient outcomes in brain, heart, lung, liver, and kidney conditions. Number 6. Germ theory. Small changes make a big impact. The introduction of anesthetics in 1844 revolutionized surgery, allowing for longer and more intricate procedures. However, post-surgery infection rates remain high until French microbiologist Louis Pasteur developed germ theory in 1861. Pasteur's groundbreaking work demonstrated that infections were caused by microorganisms entering the body. Joseph Lister, inspired by Pasteur's theory, applied antiseptic methods to surgical procedures, significantly reducing infection rates despite facing skepticism from his peers. Over the past century and a half, the application of germ theory has led to the control of numerous diseases, including the plague, dysentery, and typhoid fever, saving countless lives through improved understanding and implementation of preventative measures. Number 5. Organ transplantation, saving lives through organ replacement. The first successful kidney transplant, performed by Joseph Murray in 1954, marked a milestone in medical history, paving the way for subsequent organ transplant procedures. By 1968, surgeons achieved successful pancreas, liver, and heart transplants, with the first heart-lung transplant completed in 1981. Despite these advancements, rejection remained a significant hurdle, limiting the viability of transplants. However, the discovery of cyclosporine in 1984 proved transformative, revolutionizing immunosuppression and enabling more complex transplants, including those from live donors. As of September 2022, U.S. doctors have completed over 1 million transplants and continue to perform more than 40,000 transplants annually, significantly extending and enhancing the lives of countless patients. Number 4. Genetic engineering. Unlocking the secrets of life. The discovery of the double helix structure of DNA by James Watson, Francis Crick, and Rosalind Franklin transformed molecular biology. Mapping the human genome has proven crucial in understanding and predicting the incidence of various diseases. Currently, this knowledge is utilized for screening and interventions among at-risk groups. However, the potential for personalized medicine and gene therapies is immense and nearing everyday application. Advancements in understanding the human genome have led to the development of techniques for genetic manipulation, giving rise to gene therapy and genetic engineering. While still in its nascent stages, this field holds significant promise. Scientists can manipulate DNA by inserting recombinant DNA into organisms to rectify or eliminate faulty genetic segments, potentially reducing or eradicating genetic predispositions to diseases. Number 3. Heart surgery. Pioneering cardiovascular interventions. The first coronary artery bypass graft, CABG, performed by Dr. Rene Favaloro in 1967, revolutionized heart disease treatment by restoring blood flow to the heart muscle, alleviating anginous symptoms and reducing the risk of heart attacks. Over the last 25 years, minimally invasive cardiac procedures have emerged, mitigating risks associated with open heart surgery. Additionally, the use of robotics in cardiac procedures has led to shorter surgery times, improved patient comfort, and faster recovery. Following CABG, patients who survive the initial month have life expectancies comparable to the general population. In the U.S., advancements in cardiovascular interventions have significantly lowered heart attack death rates from 87 per 100,000 in 1999 to 38 per 100,000 in 2020, underscoring the continual progress in this field. Number 2. Antiseptics. Enhancing sterilization and infection control. Joseph Lister's pioneering work in developing antiseptics marked a significant advancement in infection control, particularly in surgical settings. Motivated by the alarming mortality rates post-surgery, Lister conducted experiments to prevent infections, leading to the development of the antisepsis system. Collaborating with his wife and assistant, Agnes Lister conducted research in a home laboratory. The aseptic technique, inspired by Lister's work, has become the cornerstone of infection control across all medical disciplines. Hand washing between patient interactions, a fundamental component of this technique, has become so ingrained in medical practice that its absence in the past seems inconceivable. Number 1. Insulin. Saving millions of lives daily, insulin stands as a monumental advancement in medicine, saving millions of lives daily. Its discovery and subsequent use in treating diabetes have transformed the landscape of healthcare, offering a lifeline to individuals afflicted with this chronic condition. Through the administration of insulin, countless people can manage their blood sugar levels effectively, preventing life-threatening complications and improving overall quality of life. This breakthrough represents one of the most significant achievements in modern medicine, underscoring the profound impact of scientific innovation on human health and well-being. Thanks for watching. Subscribe to the channel and hit the bell icon.